These are the top 5 infections I saw in the pediatric emergency department this week. I just finished a block of night shifts, and these are the most common things that I saw. Number 5 on the list is RSV. It's made a little bit of a resurgence in the area that I'm in. A lot of runny nose, difficulty breathing. Most of these are going to be infants and toddlers. We did have to admit some of them, but most of these kiddos are able to continue supportive care at home with nasal saline and suction and lots of fluids. Number 4 on the list is human metapneumovirus. This is a virus that is tough on the lungs. It can cause difficulty breathing. Kids look like asthmatics even if they're not asthmatics. I've had to admit some of these kiddos for difficulty breathing and respiratory support, but a lot of them I'm able to send home with, again, just continued supportive care. Number 3 is rhino/enterovirus. This is a virus that can cause a lot of symptoms, anywhere from upper respiratory, runny nose, cough, fever, difficulty breathing, a lot of difficulty breathing, and sometimes it can cause some vomiting and diarrhea as well. A lot of the asthmatics this week that I needed to admit for continued treatments and asthma exacerbation, they were positive for rhino/enterovirus on their respiratory pathogen panel. Number 2 is parainfluenza virus. This commonly causes croup in younger kids, which is waking up in the middle of the night with a barky cough and shortness of breath. And a lot of times by the time you get to the ER, everything's fine. It can also cause a really bad sore throat, kind of hoarse voice, or laryngitis in older kids. The number 1 most common thing I saw this week was acute viral gastroenteritis, and there were a couple different viruses that were causing it. I saw some norovirus, some rotavirus, and then a bunch of kids that I wasn't able to test. Probably most of the kids that I needed to admit this week, I had to admit for dehydration and persistent vomiting or persistent diarrhea because of these gastroenteritises that are going around. Things to watch out for at home is if they're starting to have decreased urine output, they're not able to keep any fluids down, or they're having really bad abdominal pain. And remember that hand sanitizer is not enough to kill these viruses. You need to get down with that soap and water. I know you may have never heard some of the names of these viruses before. These are not new or different. These are very typical viruses that have been around for often decades. Technology has advanced enough that we are able to give the common cold a name in many situations. This testing is pretty quickly done. However, it is still relatively expensive, so most kids that don't have underlying medical history, that don't need admission to the hospital, are generally going to get a flu, RSV, COVID test. But kids that have more significant medical issues or need admission may get these further testing, like a respiratory pathogen panel that tests for a ton of viruses and some bacteria. So that's what's going around this week. Stay safe out there.